An annual primary care visit is essential for maintaining overall health and plays a crucial role in preventing serious health issues.
Dr. Frank Arnold wants to stress the importance of that and build a good understanding with your primary care physician. Good morning.
Doctor.
Good morning. Thanks for having me.
Yeah, thanks for being here. So, in what ways can a consistent relationship with a primary care physician really help with those early detection or health concerns?
So your primary care physician is going to stress a lot of preventative medicine stuff, and so that preventative medicine appointments are going to look for those chronic medical problems that with early detection can be managed more effectively and prevent other problems that can arise if they were uncontrolled. In addition to that, many primary care docs also will do routine kind of care, right? So you've got the sniffles, you got the sneezes, you've got bumps and bruises. Those are things that primary care docs can manage. Also, a lot of them can do things that are kind of chronic management. So routine diabetes care, routine blood pressure management, those are things. And many of us do procedures inside of the clinic, so you don't even need to go spend time waiting for a specialist. You can come see us and we can do a lot of that stuff for you.
Yeah, women seem to be more in tune with understanding their body and acknowledging the fact that they need to go and see someone. Historically though, us men, we kind of don't do that. Why is it essential that men in general need to buck that trend and go and see a primary care?
Well, that's an excellent question. I'm glad you asked it. If you think about what are the leading causes, or if you know what the leading causes of death are for men, at the top of that list is heart disease. Heart disease is one of those things that we screen for on a regular basis. With that comes diabetes, comes chronic kidney disease, can be liver disease, even things such as Alzheimer's and cancers are things that we manage a lot, not manage, but more screen for. And so the sooner we get those detected, the more effective we are at treating those, the better off, the more likely it is we're going to stave off any of those long-term health problems that come with it. And so it's very essential for men to come in and see their doctor and ask those questions and let us evaluate your risk.
Right.
Yeah. November is Diabetes Awareness Month. So what health problems are associated with it, and what sort of screening options should patients be asking for?
Sure. So as I mentioned, heart disease is one of the things that we want to keep an eye on, and diabetes contributes significantly to heart disease development. And along the way, with that, diabetes can also cause a number of other issues. So it can affect your vision, it can affect your kidneys, it can cause chronic diseases in both of those areas. It can increase your risk for developing blood clots in your legs and in the other areas of the veins in your body. So really all in total, it's a lot of things that diabetes can contribute to, that sooner detection, sooner treatment will help prevent those things from happening.
Yeah, obviously the holidays are coming up. They're right upon us. Thanksgiving's, just over a week away. They can be a lot of fun, but they can also be disruptive and pretty stressful for someone who's in a routine for things like diabetes. So how can people still have fun, but also maintain their regular well-being?
So, I tell my patients all the time, Thanksgiving isn't a surprise. We know it's coming every year. And so there's things that you can do ahead of time to kind of prepare yourself. So if you're worried about weight management, one of the things that you consider is maybe you want to eat a lighter breakfast and a lighter lunch, and then that gives you some room for those extra calories. Don't forget that it's just one day out of the year. And so the things that you do ahead of time, that exercise, that diet control, those are much more important during the rest of the year than it is on that one particular day. And don't forget to give yourself a break, right? It's stressful. People are going to have, stressful responses. And so sometimes you just need to take a step back and, relax and remember, hey, you don't always have to be at your best.
Right.
Yes, so this late in the season, on top of and talking about that preventative care, can people still get flu shots?
Absolutely. It's never too soon to get your flu shot. We're about to head into the first peak of the flu season. So flu season has 2 peaks throughout the year, so we're coming up on that first one. The sooner you get that vaccine, the more protected you are. If you have any questions about that, please talk with your primary care doc. Sometimes it's not right for everybody, but your primary care will help you get that. And if you need a primary care, Dignity Health has got plenty that we're accepting new patients. So come on over and see us. We're more than happy to help you answer those questions.
And guys, we're looking at you as well. all of us out there. Dr. Arnold's accepting new patients. So thank you so much for your time this morning.
Thank you.
Prioritize your health and well-being this holiday season, and to learn more about everything we've discussed here, head to dignityhealth.org/NVPCP.